Hi, Mama. Welcome to Doula TEATOX, where I spill all the tea on birth, postpartum, and everything in between. My name is Maya, and I am a certified birth and postpartum doula, as well as a yoga instructor specializing in prenatal yoga. A question that I often hear is it safe to eat during labor? And the short answer is yes. Eating during labor is safe, necessary, and backed up by evidence, but policies don't always support what's best for moms. In this video, we will talk about hospital policies, birth center policies, home births, evidence, and practical tips. Let's get into it. Okay, so why eat during labor, right? Why does it even matter? Well, reason being is, guys, labor is labor, okay? We're not calling it labor for nothing. Labor can be easily compared to running a marathon, right? Would you run a marathon on an empty stomach? Or would you carb load before running that marathon? Let's just think about that question for a second. You're probably thinking, yeah, I'm gonna eat before running a marathon. Yeah, I'm gonna carb load. Why do I keep saying card lobe? Card. Oh my gosh, guys, I can't English. Hold on, give me a second. Of course, you're going to carb load the day before because you're running a marathon, right? So, why do we expect moms to labor and do the work of a lifetime on an empty stomach? It just doesn't make sense. Now, what are the risks associated with not eating during labor? For one, increased exhaustion, increased medical intervention, as well as slower labor progress. Once again, you wouldn't run a marathon on an empty stomach, so why would we do labor on an empty stomach? So, let's break down birthing location policies. First and foremost, we're going to talk about hospital policies. Now, 98.4% of US women give birth in the hospital setting. That is a really big number. So, right off the bat, I'm sure a lot of you are going to fall under this umbrella. And personally, as a birth doula living in the United States, I do support tons and tons of women in the hospital setting. So, when it comes to policies in the hospital, typically, more often than not, and some hospitals are evolving and changing, which is amazing and I love to see it. But most hospitals nowadays are still recommending that women do not consume anything during labor except for clear liquids. A lot of the time, if you're in the hospital setting and you tell somebody, hey, I'm hungry, they're going to be like, oh, okay, that sucks. Here's some ice chips. You can eat some ice chips. You're hungry? You want some water? Okay, yeah, let's get her some water. Babes, water is not going to fill up your stomach and water is not going to fuel you. And honestly, as a birth doula, it actually kind of infuriates me that hospitals are still pushing this narrative on women because there's been so much evidence that backs up that this is not what's best for mom and baby. But we're going to get into that. So, first and foremost, something you need to know is most hospitals are not going to allow you to eat during labor. And the reason being for this is that hospitals are really concerned about what if scenarios. So they're telling you not to eat and not to drink during labor because in their mind, they're already thinking about, well, what if she needs an emergency C-section? What if she needs surgery? First and foremost, babe, you are not walking into the hospital to get surgery. You are walking into the hospital to have a baby. So let's get that down first and foremost. We're not walking into the hospital with the mindset of what if. Actually, having that mindset of what if is already going to hinder your labor process in the first place. So let's just throw that out the window. Okay? Leaving that alone for a second, let's go on to birth center policies. When it comes to birth centers, they are more so rooted in the current evidence that we have right now, which is knowing that it is better for moms to snack and eat during labor. So if you're giving birth in the birth center setting, you're going to likely be encouraged to be snacking and eating small meals here and there, as well as hydrating with electrolytes, coconut water, and all of the other beautiful things. And lastly, let's talk about home births. So in the home birth setting, your midwife is likely going to give you complete free range of what you eat and what you drink because your home birth midwife really, truly, deeply knows and understands that you need fuel for your labor. So, in the home birth setting, your midwife is likely going to require that you're eating something during labor, whether that's honey sticks or, applesauce packets, sipping on a protein shake, whatever it is. More often than not, home birth midwives really encourage that you are eating and drinking sufficiently during labor. So let's take a glance back in history and figure out why hospitals started to come up with these policies. So, back in the 1940s, they discovered this thing called Mandelin syndrome. And it's essentially when the contents of someone's stomach would be inhaled by them either during or after general anesthesia. And of course, right off the bat, this sounds super scary, right? Who wants to inhale the contents of their stomach? That sounds terrible. So it's totally understandable that after the hospital started seeing this happen in their patients, that they would decide to create a policy to help prevent this from happening. But something that we need to keep in mind is while this was happening, they were using general anesthesia. Here's a secret. They don't use general anesthesia for C-sections anymore. Rarely will you walk into a hospital setting that uses general anesthesia for C-sections. Pausing myself to add that general anesthesia is when the patient is unconscious. Nowadays, we're using epidurals so that they can really localize where we want the pain relief to go. So it makes us ask the question, why are hospitals still pushing this? And I, of course, have my beliefs as to why they do this, but this is not that video, and we'll talk about that in a different video. But the facts are that we're not using general anesthesia for C-sections anymore. So the likelihood of this happening to you, of you inhaling the contents of your stomach, is extremely slim to none. Nowadays, when it comes to C-sections, hospitals are using regional anesthesia, which is really localized in the body. Thanks to the hospital changing the anesthesia when it comes to C-sections, we no longer have to worry about Mandelin syndrome. It is no longer a concern that you are going to inhale the contents of your stomach. So, now you feel comfortable eating during labor, and the question that you're probably thinking now is, okay, so I can eat during labor, cool. What should I be consuming? Well, we want to be consuming easy to digest food so your body is not having to work harder than it needs to, as well as foods that could easily be thrown up, because a very common thing in labor is throwing up. So we want to make sure that whatever you're putting down can easily come back up, okay? So we're thinking about things such as yogurt, fruit, smoothies, protein shakes, applesauce packets. I even had a client one time buy those little chia seed packets. Those are amazing, okay? Anything that's going to easily go down, anything that you don't have to give much effort to even chew and swallow, those are the things that we're going to want you to be consuming. Even things like chicken broth, vegetable broth, bone broth. These are all great things to be consuming during labor. Okay, now when it comes to hydration, what are we wanting you to drink? Well, we want you to be drinking things that are high in electrolytes. So although you may love your plain water, we don't really want to be drinking that during labor. We want to be drinking things such as electrolyte drinks, right? Like Liquid IV, or any other electrolyte packets, really. Things like Powerade, Gatorade, coconut water. These are all great options, things that are going to hydrate you, but also fuel you when it comes to your electrolyte balance. And I would like to note, some moms don't feel hungry during labor, and that's perfectly fine. I am a huge believer on listening to your body and following your intuition. So if you're in labor and you're not hungry, you don't feel low on energy, and you don't really have much of a desire to eat, I would say honor that and listen to your body accordingly. So As we close, here are my biggest tips for you. First and foremost, talk to your doctor or midwife before you go into labor and ask them all about hospital policy, birth center policies, or their home birth policies. Either route you choose, ask them what their policies are around eating. If your care provider is telling you that absolutely no, you cannot eat during labor, I would genuinely question that and maybe even look for a different care provider, because it sounds to me like they're not actually knowledgeable in the current evidence. And a lot of the time, doctors get stuck in their minds. They learned something many years ago, and that's just, it is what it is, and they're not keeping up with the relevant evidence out there. Okay. If you're putting your life and your child's life in somebody's hands, you want them to be fully knowledgeable and educated on all of the current information out there. So if you find yourself with a provider that is not supportive of eating during labor, definitely question, definitely ask them more questions, and maybe even switch care providers if needed. Remember that this is your birth and nobody gets to dictate how it goes. This is your birth, your experience. You are the one that holds the power here. The next tip I would give would be to bring snacks and to pack snacks well before you go into labor. So start thinking about what foods you would like to eat during labor. And I actually have a blog post that talks all about the best foods to eat before, during, and even after labor. I will link that down below. So if you want a little more information on what you should be eating, definitely go check out that post. And the last tip that I have for you is to know your rights. It is always better to make informed decisions than it is to just blindly follow policies. So know your rights, know your facts. Even though something is hospital policy, that does not mean that it is law, and that does not mean that you are forced to follow it, okay? This is, once again, your body and your birth, and you have a right to make decisions that are best for you and your baby. So just as a quick recap, eating equals energy, and you need energy during labor. You deserve a labor and birth experience where you feel nourished, respected, and listened to. If you enjoyed this video, please like, subscribe, and comment your experience down below. Please share this with a mom that you think could benefit from this knowledge. Thank you so much for joining me for this Doula Tea Talk, and I'll see you in the next one. Bye!